Hello, everybody. Welcome to our live session. We are going to be going over the LGBTQ community and teen pregnancy prevention. I will start in just a minute. I'm going to wait for some people to get in here. I'm going to bring the comments up on my other computer here to make sure I'm not missing any. I hope everyone is doing well today. I'm excited to get started. Hey, Destiny. It is not Mac. My name's Alexander. I know we probably sound a lot of like, actually. Hi, Shelby. Hi, Shy. I'm really excited for you all to be here. Can you all hear me? I just want to double check. I am using my personal laptop, so I want to make sure you all can hear me. So type yes if you can hear me, please. Okay, perfect. I'm so glad. Hello, Mackenzie. I'm really excited to get started. Hey, Shy. Hey, Ezra. The whole gang is here. Awesome. So I'm super excited. So just a little information before we get started going here. This is for National Teen Pregnancy Prevention Month, which is all of May. I'm sure you guys have seen us posting a bunch of stuff about it. We have our own page, National Teen Pregnancy Prevention Month. Let me just tag that here. It's a long page name. So tag that right here in the comments. You can go there, look up all of the things we're doing. Tonight, right after this presentation, we're going to be doing bingo, in which you are eligible to win a gift card of your choice, which is really awesome. The education session is going first because we are going to go over some of the answers that are on the bingo sheet, so it's important that you listen. And if you have any questions during this time, you are definitely welcome to ask at any point. If you need any clarification, you're welcome to ask. Very open to any kind of question. Just try to be, not offensive. You want to use your best language you can. So yeah, we're just going to go over pregnancy and the LGBTQ community. And I'll start in a few minutes, give people a little more time to get on here, and then we will get started. I hope you all are doing well tonight. I apologize in advance if my cat meows a lot. His dinner is at 5, and he starts begging for dinner around 3. So he might meow or like jump on the computer or something. He can be kind of annoying, so I apologize in advance. But I think we'll be okay. And advocates and educators and peers, if there's information you wish to share, definitely drop it in the comments, jump in at any time, and I will share it over the live. Hello, Susan. Welcome to our presentation. We're going to go over the LGBTQ community and teen pregnancy prevention, and we will have bingo at 5 o'clock, in which you are eligible to win a gift card of your choice. And a lot of the answers are going to be in here in this presentation. Hannah says, I'm so impressed that you have a dinner routine with your cat. My cat runs her schedule and she is fat. Yeah, my Walter gets fed in the morning, around 5 in the morning, and then 5 o'clock at night. And then he gets a meal at midnight because cats usually eat more often at night. So we try to feed him more at night than during the day. But yeah, he has a schedule. Otherwise, he would just sit at a bowl and eat all day because he's got food anxiety from being on the street. Walter. Hello, Caitlin, and also hello, Hannah. I'm glad you all are here. Okay, so we can just go ahead and get started. I've got a bunch of awesome information here to share with you all, so I'm super excited. I worked really hard on this presentation. I apologize in advance if there are typos or grammar errors. I looked through a bunch, so I'm hoping it's pretty solid. Okay, so let's get started. So before we get started, I would like to talk a little bit about OCO's health education services specifically. I know we talk about them a lot. I try to, talk about them every time I'm on a live. So I just want to get that down before we get started. So of course we have our LGBTQ drop-in. That is every Wednesday, 4:30 to 7:30 p.m. when we are at our office. As of right now, we are just doing our programming on Facebook Live from around 4 o'clock to 6 o'clock at night. Our office, where we normally meet on Wednesdays, is 9 4th Ave in Oswego, New York. That's also the clubhouse or the spot space. And LGBTQ drop-in, we usually do, it's very youth-focused, very youth-led, as in youth pick what they want to do. So usually people just kind of want to hang out and eat snacks, and that's totally fine. We hang out, we eat snacks. We've got video games. We can do education sessions, whatever you need. Another program we have is OCO Teen Pregnancy Prevention. We can deliver free condoms to you and link you to reproductive health care. We also have our OCO Youth Health Advocate Program. Also can deliver free condoms and link you to HIV/STD testing. These programs kind of commingle a lot, and we as advocates can do any of these things for you. So you can reach out to any advocate you are comfortable with or educator you are comfortable with. Doesn't matter where they work. We can get you connected to anything you need relating to sexual health. So Teen Pregnancy Prevention Team is Hannah, Savannah, and Nancy, and Heather. So they are all part of the TPP team. OCO Health Advocate Program are me, Shai, Shelby, and Ezra. We also have the SPOT program, which stands for Sober Peers on Top. It is a group that, it's kind of like a drop-in group. You meet Monday, Tuesday, Thursdays, Fridays, and Saturdays, 5 p.m. to 10 p.m. It is a space where, we do not talk about any kind of substance use, anything like that, unless it's about, addiction as in like an objective term. We do a lot of programming to help improve, life skills, goal building, all that kind of stuff. We do a lot of fun stuff. There are video games, we have food, all of that stuff. So that's really exciting. Again, not in session right now due to COVID-19. The SPOT does have their own Facebook page in which you can do their daily programming. So let me link that in the comments as well. A lot of fun stuff. I've been on probably all of their programs almost every night. They do a bunch of fun stuff such as Jeopardy, Netflix watch parties, trivia, karaoke, virtual hikes, bunch of stuff. So check out their page. They are doing their own program like we are. So yeah. Next we have OCO Family Planning Services. This is pretty much the same as TPP, except it's for all ages. It does not discriminate against age. You can contact if you are, above the age of 20, and we can get you your services such as free condoms, link to reproductive health care, and information about birth control and stuff like that. And lastly, we have our OCO Reproductive Health Centers. The main centers are in Oswego and Fulton, but we do have satellite centers in other cities in Oswego County. We offer many different services, such as birth control, access to condoms, wellness checks, all of that kind of stuff. And if you ever have any questions on the services we provide, you can reach out to me. You can reach out to any of our advocates. And another program I didn't put on here, but is also part of the health education services, is OCO's 2 for 2 program. That is a after-school program at the Fulton Junior High run by Marissa and Tyler and Caitlin. They focus on goal building and that kind of stuff with middle school age children. So that is another program we do offer if you are looking for those kind of services for middle school age children. Okay, so we're going to jump right into our program now. Okay, so here is our logo that we have for National Teen Pregnancy Prevention Month. Okay, but first, birth control. Cheyenne designed that, which was really cool. It's also on our t-shirts. You can get one of our t-shirts just by contacting us. It is also included in the prize packs when you win something. So if you are interested in our t-shirts, definitely reach out so you can get one. Okay, and we're going to start out with overall statistics about teen pregnancy in the United States. So every day, 682 teens aged 15 to 19 give birth in the United States. 1 in 4 teens become pregnant before the age of 20. Teen birth rates are 9 times higher than any other developed countries. Black and Hispanic teens have birth rates 3 times higher as their white peers. And New York has a lower birth rate compared to other states. And Oswego County has the highest teen pregnancy rate of central New York. So that really depends. There's a lot of things that go into those statistics, such as geography, socioeconomic status. Obviously, race goes into those statistics. It's a lot of different things that go into there. Hannah, just the other day, did a presentation on the National Teen Pregnancy Prevention page about statistics and about teen pregnancy prevention rates, teen pregnancy rates throughout the United States. Something definitely to check out. Again, it's on the National Teen Pregnancy Prevention page that I linked on the comments if you would like to look at that. I'll give you guys a little bit on this slide just to look it over and ask any questions if you have them. No, and if I'm going too fast, you are welcome to, let me know, tell me. Oh, I can hear my cat climbing all over everything. Oh my God. Naughty. Okay. So the next page we have is about LGBTQ plus youth. So this is just some basic statistics about LGBTQ youth in the United States, just to give you a little overall information about that. So it is estimated that there are 3.2 million, there should be a million there, 3.2 million LGBTQ youth in the United States alone. That's about 7 to 9% of youth identify as LGBTQ in some way. 52% of LGBTQ youth are also youth of color, which is surprising because that is a lot more people of color identify as LGBTQ if they are younger compared to people who are older. 1.8% youth are transgender or identify as transgender. That is outside of the 7 to 9% of youth identifying as LGBTQ. Surprisingly, only 12 states are required to discuss sexual orientation in sex education. So that is surprising, and what's even more surprising is 3 of those states are required to teach inaccurate and harmful information. So for example, in Alabama, sex educators must teach that homosexuality is not a lifestyle acceptable to the general public, which is extremely harmful for people who do identify as, gay or lesbian or anything in the LGBTQ spectrum. So that is extremely harmful, and there are no states that mandate the discussion of gender identity. So if you were able to discuss LGBTQ topics in your sex ed class, you are very fortunate. especially if it was in a positive manner. Very fortunate. A lot just kind of do not touch that subject, are not mandated to touch that subject. So a lot of teachers may feel uncomfortable with that topic and kind of brush over it. But these topics, talking about these topics, are really beneficial to youth, not even LGBTQ youth, to youth in general. So they are, shown that there are different people out there and it's okay to be different. So yeah, I just learned a lot of this stuff just looking up, and it was very shocking to me that only 12 states require discussion of sexual orientation in sex ed, and 3 of those states are required to teach inaccurate information. So they're required to teach this information, but it has to be inaccurate, which is just, heartbreaking, honestly. Do we have any questions about this slide? You're welcome to ask any question, even if I go over it and it's, a past slide. So I'll give you a minute to look at this slide. Again, if you have any questions or comments, you're welcome to drop them in the comment box. Okay, I'm going to go on because I do have quite a bit of slides going on here. Okay, teen pregnancy and LGBTQ plus youth. So a lot of people might think this isn't important. LGBTQ youth is not something that we're gonna see a lot in teen pregnancy, but that's actually the opposite. The average of LGBTQ teens involved in teen pregnancy is 12 to 17%, compared to an average of 2 to 5% of the heterosexual teens. Yeah, Shah, I know. How sad that they are made to teach inaccurate and harmful information. That's just, I just can't believe that. Luckily, I was fortunate enough to grow up in New York. A lot of people are not that fortunate. So, okay, let's see. So a lot of people think LGBTQ youth don't have to worry about teen pregnancy, and that's actually quite the opposite. Because LGBTQ is a lot more than lesbian, gay. LGBT stands for specifically lesbian, gay, bisexual, transgender, queer, and the plus is everything else. So, that acronym can vary from whoever is saying it. But usually it's LGBTQ plus is usually the most accepted acronym. Transgender youth are just as likely to be involved with a teen pregnancy as their cisgender peers. Cisgender just means that these people identify with the sex they were assigned at birth. So if you were assigned female at birth and you identify as a girl or a woman, you are cisgender. Some people might think cisgender is a slur. It is not a slur. It is just the opposite of transgender. And transgender is just the opposite of cisgender. Transgender, just to clear that up, is when somebody identifies, when somebody does not identify as the sex they were assigned at birth. So, for example, if someone was born male at birth and they now identify as female, they are considered transgender. LGBTQ youth are often overlooked in teen pregnancy prevention measures. Again, like I said, because a lot of people associate LGBTQ with just lesbian and gay. And, lesbian, gay, that means they're attracted to the same sex. We will go over why that isn't 100% the, why that isn't 100%, preventative either. LGBTQ youth do not feel included in sex ed and therefore cannot connect with it, leaving them vulnerable. And this is very true. I've had a lot of LGBTQ youth and, myself included, not feel included in the sex ed that is taught at public schools. And they cannot connect with it, and therefore they do not, tend to tune it out or not listen because they feel like it is not applicable to them, because they are not getting those examples of LGBTQ people or role models, or just examples of relationships in a way where it is, preventing pregnancy, or preventing STDs. The only time a lot of youth see LGBTQ being discussed in sex ed is in relation to HIV and AIDS. And that is because of the historical context of HIV and AIDS during the 80s. And a lot of the time that is more focused towards gay men. So a lot of people are feeling left out of sex ed and left out of teen pregnancy prevention measures. Any questions on this slide, you can drop them in on the comments. I will leave this hanging for a minute so you can look it over. Okay, on to the next one. So just a little more about teen pregnancy and LGBTQ youth. LGBTQ teens are more likely to have sex earlier compared to their cis-het peers. Just before we go on, cis-het is just short for cisgender and heterosexual. It's just kind of an acronym just to say, you know, people who do not identify as LGBTQ in any way. Again, it is not a slur. Cis-het is just a shortened term for people who are not LGBTQ. And LGBTQ teens are more likely to have unprotected sex as well. This could be linked to how they do not feel included in the sex ed that is provided at public schools. And this could also be linked to the pressure of having sex early on if you are LGBTQ identifying. A lot of people link sexuality and having sex to the LGBTQ identity, and that is not true at all. There are people who do not identify sexually at all, or who are not interested in having sex at all in the LGBTQ community. Just because somebody is LGBTQ does not mean they are inherently sexual or inherently risky when it comes to sex. But statistically, it does show that they are earlier. They have sex earlier compared to their cis-het peers and are more likely to engage in unprotected sex, most likely because they do not feel included in sex ed and do not engage with it. So here are just a few LGBTQ specific risk factors that come with teen pregnancy. So experiences of exclusion, harassment, and violence. There is, you know, a great deal more of exclusion, harassment, and violence with LGBTQ youth compared to their cis-het peers. Lack of diverse relationship examples. In sex ed, there are a lot of heterosexual relationship examples, especially when talking about teen pregnancy. So it's very, you know, cisgender, very heteronormative. So LGBTQ youth feel as if it is not for them, or it does not even apply to them. So that causes a lot of problems. Pressure to conform to heteronormativity. Heteronormativity is just a big word for cisgender and heterosexual to be the norm. It is also a term for, you know, masculine and femininity to be the norm. So it just means that, you know, straight couples and cisgender couples are more accepted in society than LGBTQ people or couples, which is not the case. So a lot of LGBTQ people are pressured to conform to heteronormativity, so they are, you know, they can feel more comfortable with themselves or their identity, or they can feel more comfortable with their family. Lack of focus on pregnancy risk given HIV focus for LGBTQ youth. So like I said earlier, sex ed is very focused on cis-het couples, and the only time LGBTQ people are brought up is when we are talking about HIV or AIDS. Not so much nowadays when it comes to states like New York. HIV and AIDS is very non-discriminate nowadays, but in other states and southern states, you're more likely to see HIV still being linked to LGBTQ community, specifically gay men. So if LGBTQ is mentioned at any point in sex ed in states like Alabama, we're going to see a lot more of it just being HIV focused and very negative. Lack of positive LGBTQ plus role models. That is still the case nowadays. There are not a lot of LGBTQ plus role models that are as famous as, let's say, cishet role models or cishet celebrities. But we do have our LGBTQ plus role models such as Laverne Cox, who is an open trans woman who advocates for LGBTQ youth and LGBTQ inclusive sex ed. And there is also the pressure to conceal sexuality or gender identity and remain in the closet. So being in the closet is a term used to describe not being open about your sexuality or gender identity, or going with the assumption that you are straight, that people assume you are straight and not really questioning it. There is definitely a pressure to conceal sexuality throughout life, because LGBTQ is still considered something outside of the norm, even though we are trying to normalize it and trying to be more open about it. It is still something that is considered abnormal, and I'm saying that because people still feel the need to have to come out and not just live their lives as an LGBTQ person or as a trans person per se. So they still feel like they have to come out and they have to make a stance and say, listen, I am not heterosexual or cisgender. This is what I am. So there is still that pressure to conform and conceal your sexuality, which can be a risk factor in teen pregnancy prevention. Do we have any questions before I go on? Walter sounds like he has a question. I don't know if you can hear him meowing, but he's meowing a lot. Silly boy. Okay, we will go on. And again, if you have anything you'd like to add, you're welcome to add it to the comments. And I will, say it in the live. Okay, so now we're going to go on to transgender youth and pregnancy specifically, because I feel like there is a lot of confusion along with transgender and hormone therapy in pregnancy. So hormone replacement therapy / puberty blockers does not make trans youth infertile. So hormone replacement therapy is what trans people go through when they want to either masculinize their body or feminize their body, and have those second sex characteristics such as facial hair or kind of like more muscle, or they want to have breasts or less facial hair. They're going to want to go through hormone replacement therapy. Puberty blockers are for youth that have not gone through puberty yet and are questioning their gender, or they are transgender and would like to not go through puberty as their assigned sex. Puberty blockers are not damaging, despite what you may have heard, and are completely reversible, whereas hormone replacement therapy is not completely reversible. Especially being on it for a long time. There are some changes that are not going to be able to be reversed, such as vocal changes and changes with genitalia. They are not going to be able to be reversed. But puberty blockers are completely reversible and do not make trans youth infertile. Neither of them do. HRT, which is short for hormone replacement therapy, is not a birth control method. Trans men and non-binary people can still become pregnant even if on HRT. So trans men and some non-binary people may want to get on hormone replacement therapy, which will be testosterone injections. And that is not going to make them infertile. That is not going to be a good method of birth control at all. Trans men are going to still be ovulating, within 6 months of being on HRT, and can still get pregnant even after 2 or 3 years of being on HRT. So it is important to still have a birth control method, even while you are using hormone replacement therapy. Trans women and non-binary people can still impregnate someone else even if on HRT. So HRT for trans women and some non-binary people is going to be a combination of estrogen, progesterone, and androgen blockers, which are testosterone blockers. And it is not going to decrease sperm count. It is not going to decrease fertility at all until a few years out. And by a few years out, I mean like 4, 5, or 6 years out. So that is something important to keep in mind. HRT is not a method of birth control. And just to reiterate, trans youth feel as if sex education does not include them. As I stated earlier, I said that no states are required to teach gender identity. So that is a huge gap. Trans youth don't feel as if sex ed does not include them. It's just, if you're not going to talk about gender identity or anything related to gender, trans youth are not going to feel included, and they're not going to feel like it is about them or that they need to listen. So that is something important as well. Okay, next slide. So we've got some options relating to birth control here for AMAB youth. AMAB just stands for assigned male at birth. It is something that a lot of trans people are using nowadays to describe themselves or describe how they are trans. So for example, me, I am a trans man. I am AFAB, assigned female at birth, but I go by he, him pronouns, and I identify as male now. But I was assigned female at birth. So we're going over options for assigned male at birth youth. So these are going to be barrier methods, are best used from AMAB people because we don't really have hormonal options for people assigned male as of right now. I know there are some in the making and some in trials, but we don't have anything right now. So this would include external condoms, internal condoms, and dental dams. So external condoms you're going to find at grocery stores. They are just the normal male condoms, also known as male condoms, but we like to use the term external condoms because it is more gender neutral. These are the condoms that slide over the penis before inserted into either the vagina, anus, or mouth. Internal condoms can be inserted into the vagina or the anus before intercourse. If you are using internal condoms, you are not going to want to use external condoms as well. Doubling up on condoms is going to cause tears, which is going to cause fluids to be transmitted. Dental dams are specifically for oral sex being performed on the vulva or anus, not on the penis. It is just a latex flavored sheath that is put over the vulva or anus before oral sex is performed. So yeah, you're going to want to use a flavored or non-flavored condom for oral sex, not a dental dam when it comes to oral sex on a penis, because it's not going to be able to cover up the whole penis and it's probably going to fall off. So you're going to want to use a flavored external condom for oral sex on a penis. And communication with sexual partners about other methods is very important. So if an AMAB person is having sex with an AFAB person, assigned female at birth, you're going to want to talk about other options such as hormonal or non-hormonal options when it comes to birth control. So communication is definitely an option and definitely required when it comes to having sex. Do we have any questions before we move on? And again, if you have anything, if you have a fact you want to share, definitely pop it in the comments and I'll let everyone else know, because it's definitely important for, if you have something else or a different kind of term, I would love to know that. Okay, we will go on then. So there are a lot more options for AFAB people, options for AFAB youth, also known as assigned female at birth youth. So there are hormonal and non-hormonal options for AFAB people. So really it's because, AFAB people are the people with uteruses most of the time, and that's where pregnancy happens. So hormonal options include the birth control pill, the patch, the implant / Nexplanon, Depo-Provera shot, and the IUD, specifically Mirena, Kyleena, Liletta, and Skyla. Those are all different brands of IUD, different kinds that vary from the types of hormones used and how long they are effective for. So the hormonal IUD can be effective for 3 to 5 years. Okay, so these options here, I will go over each of them a little bit. So the birth control pill is just a combination of estrogen, progesterone, of either or both, that is taken every day at the same time. It is probably one of the cheapest options, one of the most available options, can be prescribed by a provider at our OCO Health reproductive health centers. Any of these options can be, honestly. The patch is, as it is, a patch, like a Band-Aid. It releases hormones through the skin. It is placed on somewhere on the skin every week. You put on a new patch every week, take it off the 4th week, and you have your period. We have the implant and the Nexplanon, which is a long-term form of birth control. It goes into your arm, just right under the skin, and it releases hormones for 3 years. So it's something you don't really have to worry about if you know, remembering something is a concern for you. We have the Depo-Provera shot, which is a hormonal shot that is given every 3 months by a provider. Good option if you are, you know, not interested in taking a birth control pill every day, but you don't want something long-term like the implant or the IUD. So next we have the IUD, which is, again, is a long-term one, 3 to 5 years. The Mirena, Kylena, Liletta, and Skyla. You're going to want to talk to your provider about which one is best for you, and what kind of, you know, long-term, how long you want it to be. So hormonal options can also lessen or terminate period symptoms or your period altogether. So that is an option for people who identify as, identify as trans men or non-binary people who may be getting gender dysphoria from having their period. Gender dysphoria can just easily be described as feeling not one with their body, whereas their gender and their body are not lined up, and that can bring out feelings of depression, anxiety, anger in a lot of people. So hormonal options that can lessen or terminate a period is very helpful for a lot of trans people. And hormonal options do not interfere with transition-based HRT. So if you are on testosterone and you have been on testosterone for a long time, and you are now interested in taking, let's say, the birth control pill or the patch, you can definitely do that. You're going to want to talk to your provider about which options are best for you, which combination of hormones are best for you. Of course, you are definitely going to feel side effects. Just because you're on testosterone doesn't mean that you're not going to have hormonal side effects from these hormonal options. You may still gain some weight. You might get acne. And it is different. It's completely different for everybody. So yeah, hormonal options do not interfere with transition-based HRT and are still an option even if you are years on testosterone therapy. Barrier methods should also be used with hormonal options. So even if you're on the IUD or you're on the pill, you should still be using condoms and dental dams just to protect yourself from STDs such as chlamydia, syphilis, HIV, all of that stuff. And birth control methods are not 100%. The IUD is 99% effective, but there is that 1% effect that could result in an unintended pregnancy. So barrier methods are definitely helpful. Okay, so Ezra, plop something here in the comment. Okay, so Ezra says, and many times gender dysphoria symptoms can differ from person to person. Not every trans person experiences the same types of dysphoria for different parts of their body / environment. That's a really great point, Ezra. So, gender dysphoria is very different for everybody, looks different for everybody, for every trans person. A lot of people will feel dysphoria about their body, whereas some people might not feel dysphoria about their body at all. Some people may feel dysphoria about being referred to as, let's say a trans man is being referred to as, a girl or using she, her pronouns. That's going to cause a lot of social dysphoria. And some people may have social dysphoria over gender euphoria. I mean, social dysphoria over gender dysphoria. So yeah, that is a good point, Ezra. Thank you so much. Okay, we have a little more for options for AFAB youth. Again, AFAB just means assigned female at birth. Some trans youth prefer not to use hormonal options, and that's completely okay. Non-hormonal options can be the IUD. There is a non-hormonal IUD called the Paragard. So this IUD will not cease, period symptoms or anything like that because it is non-hormonal, but it will protect you 99% against pregnancy if that is what you are looking for. So the Paragard can last for up to 12 years, which is a long time. That doesn't mean you need to keep it in for 12 years. If you decide you want a different option or you do want to become pregnant after some time, the IUD can be taken out at any time. Next, we have the diaphragm, which is not as used anymore as often, but it is still an option for people looking for non-hormonal options. So what it is just kind of like a disc that is inserted into the vagina before sexual intercourse. It is not meant to stay in there all the time. It is before sexual intercourse. You put it in there, and it's a barrier method for your cervix. So sperm cannot get into the cervix. That is something you cannot just buy at a store. It is something you need to have prescribed by a doctor because everybody's cervix is a different shape and size. So it needs to be fit for you so it doesn't, slide out of place or anything like that. And the last, again, is not used very often, but spermicide is an option. We recommend using spermicide and condoms because that is a great way to prevent pregnancy if you're interested in non-hormonal options. Non-hormonal options will not affect one's menstrual cycle or symptoms, just to keep that noted. If you are having dysphoria related to your period, it is probably best to do a hormonal option. Barrier methods should always be used with non-hormonal options as well. The IUD, the Paragard, is still 99% effective, but there is still that 1% chance of a pregnancy happening. Spermicide is not as effective as an IUD or a diaphragm, so it is very, 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 you should always be using a condom with that. It's very smart to do that. So yeah. Do we have any questions before we go on? I think we are actually almost done here. Just a few more slides. You can always chime in if you have anything you want to share. Okay. Oh, we have another one. So another option for assigned female at birth youth is emergency contraceptive, also known as Plan B, is an option as well, but should only be used when necessary. Emergency contraceptive is a pill that is taken after having unprotected sex in which a pregnancy could have happened. It should be taken within 72 hours after having unprotected sex. You can get it at a pharmacy such as Kinney or Walmart. It is kind of expensive, can range from $40 to $60. Sometimes I have seen them at $80. You can also get a prescription for it from a doctor, so it can be covered by your insurance, but it's best to probably go buy it over the counter because it is most effective closer to when the unprotected sex happened. Again, EC, emergency contraceptive, will not interfere with one's transitions-based HRT. So it will not affect your testosterone or anything like that. Okay, and we have here, as I mentioned before, so LGBTQ people may feel as if teen pregnancy does not, apply to them because they identify as either lesbian or gay. So being attracted to the same gender does not mean you do not need to worry about unintended pregnancy. Gender does not equal genitalia, as we have been talking about. Transgender people, let's say there are transgender lesbians who are attracted to women. In that case, assigned male at birth people are usually still have penises and can result in a pregnancy. So you could potentially have a transgender or intersex partner in which a form of birth control will be needed for sexual intercourse. You could also use this information to help your friends and family It's also really good to always have this information on hand if your friends or family have questions about, teen pregnancy prevention or birth control or anything like that. This information is very helpful. You could help somebody else out. And lastly, if in an open or polyamorous relationship, you could be involved with an unintended pregnancy secondhand. So open relationship and polyamorous relationships are two different kinds of relationships that are kind of like, in the same umbrella. Open relationships are typically described as having sex, being in a relationship, but having sex with other people. Polyamorous relationships are usually having a relationship with multiple people. So let's say you are in a homosexual relationship with your boyfriend, but your boyfriend identifies as bisexual and is also dating a female, assigned female birth person who identifies as a female. They could have an unintended pregnancy, and therefore you will be, as part of that relationship, part of that pregnancy. So it is important to have this information on hand for when that happens, for when, you can talk about these things and birth control with your boyfriend if you are in a homosexual relationship, and talk about how you would like your boyfriend to, be safe from, not only STDs, but pregnancy prevention as well. So that is important too. And Walter just jumped up on my lap. Oh, baby. Do we have any questions? I think that might be the last slide. Yeah. So do we have any questions? And of course, I want to thank you so much for being here on the live and being here for this presentation. I had a lot of fun making it, and I hope you all learned a lot and had a lot of fun as well. So please feel free to drop your questions in the comments. I'll leave this slide up for a bit so you guys can, type your comments up. And Walter will just be here hanging out. Again, before you skedaddle off this live, we do have bingo coming up next from 5 to 6, hosted by Hannah. And a lot of the answers for that bingo game were presented in this slideshow. So you've learned a lot and you are ahead of the crowd. I'll leave it up for a few more minutes and you can ask your questions if you have them. Again, before I close the live, I want to talk a little bit more about our services and what we provide, and specifically National Teen Pregnancy Prevention Month. We've got a lot of awesome activities going on. This Friday, we are going to be playing Jackbox games over Facebook Live. Sorry, I got a hair over my laptop. And you have a chance to win a gift card as well during that. So come play games, completely free for everybody. All you need is your smartphone. So that is something we have going on. And then next week we are going to be playing a game. Not playing a game. We're going to be watching a movie. We're going to be watching Juno through Rave or Facebook Live. I'm not really sure yet which one. So I'm excited. I hope you all are excited. If you ever have any questions about, reproductive health issues, your sexual health, getting condoms, anything like that, you are able to reach out to any of us. We are all, allies. We are all here for you. So yeah, Hannah asked a question. What are some ways allies to the LGBTQ community can help make pregnancy prevention more inclusive and their LGBTQ plus identifying friends/peers feel included? So that's an awesome question, Hannah. Thank you so much for bringing that up. That's a question I actually get a lot. So the way to make the LGBTQ community feel most included in sexual health education or anything like that is to just use gender neutral language. and just talk about, sex in its most basic terms when it comes to just, penis, vagina, anus, and just, oral sex, vaginal sex, anal sex, instead of saying things like having sex with men, women, all of that other stuff where, like, you just want to kind of disconnect sex from gender in the best way possible. And, from teaching sex in high school, I know that's very hard to do. And, I'm trying my best as a trans person. So I know it can be very difficult to do sometimes, especially talking with kids who have been raised in a heteronormative kind of society and have learned that sex is a heteronormative kind of thing. So the best is to just, use gender neutral language and include, LGBTQ relationships and identities in your examples. So, it could be an example easily as using, gender neutral pronouns or, same-sex relationships. Anything like that is going to make people feel a lot more included and a lot more like, oh, this is actually for me. I should pay attention. So that is a super good question. Thank you so much. So if we do not have any more questions, I will end that now. And again, 5 o'clock on the same page, LGBTQ drop-in, we have bingo going on, which I'm really excited about. Again, you can win a prize. I had so many answers on this slideshow, so I hope you paid attention. I'm really excited to see who wins, and I'm excited to see who's there, and I'm excited to play. So I hope you all have a wonderful night. Thank you so much for dropping in. I appreciate it a lot, and I hope you stick around for more programming from our LGBTQ drop-in page and all of our pages put together. If you ever have any questions, feel free to reach out. You can just message the page, or you can message me or any of our advocates or educators. So yeah, again, thank you so much, and I hope you all have a wonderful night.